Dr. Corley Barnes is still unpacking, set to see her first patients next month. She's a new family doctor in Reddekopp. It's a small community between Toronto and Ottawa.
Most of everything in this room has been paid for by the municipality, which has been a huge, huge, huge help.
She'll also receive a big bonus, $150,000, paid for by the local county if she stays for 5 years.
I have student debt, right? Like there's a big cost that comes with being a physician. So their incentive was a really big draw for sure, but it was also this particular clinic and how they run things.
Hastings County has been offering these perks for new family doctors for almost 20 years. More than 80% of them have stayed beyond the 5 years.
It's important for us to recruit doctors to this area, but the intention of the program since day one has been to not only recruit, but to also prioritize retention.
Just last year, they added a new $150,000 bonus for emergency physicians. A 15-minute drive away, it's the village of Marmora putting up the incentive money.
There has an office at the far end.
Here, they get a free apartment in the same building as the doctor's office, plus $100,000 for a 5-year commitment.
I just want to say that health care is not the responsibility of the municipality. It's the responsibility of the province.
Despite that, the mayor says her municipality put up the money because health care was the #1 concern here.
I think right across our country, there's a problem with the healthcare system and funding it. And yes, the formula definitely needs to be reviewed.
Within the county, municipalities signed an agreement not to poach each other's doctors. Other nearby communities have similar incentives and recruitment efforts.
I live in a relatively stress-free environment, like no traffic.
So we've got a beautiful acreage for my kids to have that outdoor experience.
It's at a time when 2.5 million Ontarians don't have a family doctor. While some of these pitches have existed for years, the Liberal health critic says others are now getting involved.
It is private store owners, car dealerships, golf clubs that are reaching into their own pockets to try and make their community more attractive to physicians. That has never happened before.
A spokesperson for the health minister pointed to the Ford government's extra spending on primary care and adding more spots in medical schools. Back in Reddekopp, Dr. Barnes is expecting a busy practice.
There's a need everywhere. Everywhere I've gone, it is the same thing, and it is really sad.
Lorenda, Reddekopp, CBC News, Toronto.